Welcome to the Chambercast.
Welcome to the Chambercast. I'm your host, Jamie Lawrence, and I'm here with Dr. Oliver from Premier Spine and Sports Medicine. How are you?
I'm good. How are you doing?
I'm very good. Can you give us a little background on yourself?
Yeah. So, like you said, my name is Emily Oliver. I am a Washington County native. Went to Williamsport High School, graduated in 2011. Have lived here pretty much my whole life, with the exception of going away to school. I started at Hagerstown Community College and then transferred to Taylor University. It's a really small Christian school in Upland, Indiana. No one knows what it is. No one's ever really heard of it. Actually, our owner, Dr. Clark, also went to Taylor University, but he's about 10 years older than me, so we were not there during the same time. I graduated with my Bachelor of Science in Exercise Science in 2015, and then went to Shenandoah University afterwards for their physical therapy program. So I finished there in August of 2018 and graduated with my doctorate of physical therapy.
What's inspired you to get into this realm of work? Were you an athlete growing up?
Kind of, yeah. I'm not the most coordinated person, but I was a runner and really enjoyed running and being active. And I wanted to do something in healthcare, but I wanted to have a more active treatment approach, and I felt that physical therapy kind of met the best of both worlds. We are in a wide range of settings, so we can be in an outpatient orthopedic practice, we can be in a pediatric setting, working with children with developmental disabilities. Therapists are also in the hospital, skilled nursing facilities. I think across the board, really our goal is to just help people move better and optimize their function, and that ultimately improves their quality of life.
So you're not a chiropractor, which I asked you before we started. There's a clear difference between the two.
Yes.
Can you break that down a little bit?
Yeah, I think I can. So I think from a chiropractor standpoint, to my knowledge, their treatment is more focused on the spine, which the spine can be the center of a lot of issues, pathologies that we deal with. As a physical therapist, our evaluations look a little bit different. We do the manual techniques. We are trained to do adjustments or the manipulations, but we also have other tools within our toolbox, such as postural reeducation, therapeutic exercises, kind of movement re-education as well. So differences, but also overlap between the two professions.
Okay. What could I expect coming in for an evaluation from you?
Yeah, so with the evaluation, we have a 40-minute time slot for the patients. And really, the most important thing to me during that time period is getting the history and kind of hearing the symptoms that you've been experiencing, what brought them on, what different treatments that you've tried. That way I can get a better understanding of what's going on. And after that, we get into our objective examination. So most of the time we'll do some functional testing, we'll watch your walk, do some squats, what is applicable to kind of what you're coming in for.
Okay.
And again, looking at range of motion, strength, flexibility, that way we can identify the impairments that are affecting your day-to-day function and really figuring out a treatment plan for you.
Now, is this tailored specifically to sports and athletes, or can an old chubby guy like myself come in and get an evaluation?
I would say all are welcome. So our name says Premier Spine and Sports, so a lot of people think that is the only thing that we treat, but I see shoulders, knees, foot and ankle, hand, pretty much anything from head to toe.
In all ranges?
All ages,
Okay, good to know.
I'd say my youngest patient that I've had has been 7 or 8 years old, and then my oldest patient has been in their 90s. So wide range.
Okay, so I'm getting a little older, and you have them, you sleep and you wake up and your neck doesn't work for 3 days afterwards. What are you laughing at? So anybody can come in, and it doesn't have to be a sports injury. It could just be, if you're older and you tweak something or you just don't feel, your body doesn't feel right. You guys give a full evaluation of what's going on, and then you make recommendations on how to treat it.
I would say maybe what's a little bit different about us is if you're coming in for your neck, we're going to look like at your neck, your shoulder, your mid-back. We're not necessarily going to go through and look at your feet and ankle if you're there for a neck examination, but we will assess all of the relevant body areas that could be contributing to it, and could be a sports injury, could be you slept on it, funny, could be you had a knee replacement and you need therapy afterwards. So we really see a little bit of everything.
Okay. And so why would I choose the Premier? Why would I come to you guys? I know there's not a lot in the area there, but there are a couple other companies that offer this. Why choose you guys? Why come to you?
Yeah, so I'd like to say that, we have what's called the Premier Difference, and part of that is we have our medical office side and our physical therapy side that are attached within the same building.
Okay.
And a lot of times patients will come into the medical office and
Okay.
one of our providers will refer them to physical therapy, and we have all their information, all their imaging, everything that the other provider has recommended, and vice versa. So people might come in for physical therapy, and then we realize maybe they need additional imaging, or we think that maybe something else is contributing to their symptoms. We can just send them down the hall to see one of our other providers, and the treatment is just very comprehensive in nature. From a physical therapy standpoint specifically, your provider is with you one-on-one the entire time. You're not getting passed off to a technician or an aide. Whoever your provider is, they're with you for that whole treatment
That's
session.
good to hear. Okay.
Yes, so I would say that is
It's
probably
a real personable experience, it sounds like.
correct.
Okay.
Yes.
All right. And what do you got? What's your hours? Where are you located at?
Yep. So we are at 13114 Pennsylvania Avenue. We are open from 7 to 5 a.m. Monday through Thursday, and then 7 to 11 a.m. on Fridays.
All right. Well, thank you so much for coming in. Is there anything else you want to add while we're here? Anything? Any closing statements? Any events you got? Any sponsorships? Partnerships?
So recently we did sponsor the Hagerstown Hub City Half Marathon.
Oh, okay. Big event. Okay.
Big event. We have sponsored the Turkey Trot in the past and plan to do that again this year.
All right.
So we try to be involved with the local events, kind of get our name out there and be more involved in the community.
Awesome. Well, thank you, Dr. Oliver, for coming in. 10 minutes is up already. It goes fast.
Okay.
Thank you so much for coming in.
Thank you for having me.